Hello and welcome to another INBDE High Yield Pearl. Today we're going to be looking at something that's super high yield on the INBDE with many questions, and that is the oral anticoagulants. So where do we start with the oral anticoagulant? So the most popular anticoagulant that they're going to be talking about on the exam is obviously going to be warfarin. Now, to understand warfarin, you're going to have to understand this coagulation cascade, which involves the intrinsic and the extrinsic pathway. Now, for warfarin, you're going to be really concerned about this extrinsic pathway. The INBDE is going to ask about 4 or 5 questions related to warfarin, related to INR. So in this brief video, we're going to describe some of the things you must know for the INBDE. So the extrinsic pathway is a pathway that basically at the end is how we look at how well someone will clot, okay? So you'll see something down here that's called thrombin and prothrombin. This extrinsic pathway is one of the ways that we look at something called PT, which is prothrombin, okay? That prothrombin time, what's important about that is that that can show you whether or not someone has an increased propensity to clot or decreased propensity to clot. So you got to make sure you watch out for that for the INBDE exam. The next thing that's going to be super, super important is that as you look at this clotting pathway and you understand that extrinsic means that you're talking about the PT. Now, an easy way to remember that, just in case you forget, the extrinsic has the 2 I's in its word. Extrinsic has 2 I's. Intrinsic has 3 I's. So guess what? The intrinsic pathway is a better way to look at PTT. The extrinsic with 2 I's is a better way to measure PT. Don't forget that. The next thing, super important, is this INR. They will ask you and want you to assume that you know what INR is, okay? They want you to know the normal values for INR. So typically you want to remember 2 to 3 for your INR, okay? 2 to 3 for your INR. If it's below 2, then you're looking at the increased likelihood of clots, okay? If it's higher than 3, then you're looking at a higher propensity to bleed, okay? So make sure when they give you that patient box and they ask you about the INR and they tell you that a patient has an INR of 5, you know what that INR means, okay? The next thing is they want to know mechanism of action for warfarin. How does warfarin work, right? So warfarin, basically think of it like this. Warfarin is war. What is it war against? It's war against vitamin K. What does vitamin K do? Vitamin K is important for clotting. Specifically, warfarin is against vitamin K epoxidase reductase. Vitamin K epoxide reductase, VKER. That's what warfarin inhibits, okay? So if you inhibit the vitamin K, guess what happens? That's right. You inhibit that ability to clot. So remember that mechanism of action, super, super important. So what else? Well, guess what? Vitamin K has what we call vitamin K dependent factors. And the way we remember those vitamin K dependent factors is something called 1972. So imagine a little zero behind the 1. That is factor 10, factor 9, factor 7, and factor 2. The additional factors for vitamin K are protein, C, and S. Now, just remember this. These are vitamin K dependent factors. What happens if warfarin inhibits vitamin K epoxide reductase? What happens to these factors? If you said reduce, you're absolutely correct. That's right. So remember that also for the exam. So 1972, protein, CNS. INR. So again, what is INR? It's basically just looking at your prothrombin time, right? And that prothrombin time of the patient over the prothrombin time of the normal population. That is your INR. Now, I will say this. One of the things that you may see, they may ask you about, is this right here. Warfarin's interaction with other things like barbiturates, like phenobarbital, things like that, rifampin, which we know is important, that we've seen with TB medications, griseofulvin, which is an antifungal. So you want to make sure that you understand these interactions. Now, here's a little trick. Most times when they're talking about barbiturates, rifampin, things like that, they're talking about warfarin's interaction with the P450 system of the liver, okay? Now, that is important. Why? Because that's where it's metabolized, okay? So make sure you really understand those things that either speed up the P450 system of the liver or slow down the P450 system of the liver. Now, some of you may be scratching your heads right now and say, what in the world is Dr. Sutton talking about? What is the P450 system of the liver? Well, we can't go into it in detail right now. We do it in our course. We go through it extensively in the course. We break down what the P450 system is. We break down the coagulation cascade. We do all of that in our full course. But for right now, if you're just looking for what things they may ask you about on the INBDE exam, related to oral anticoagulants, these are the things that they're probably going to ask you about, okay? Now, what are you majorly concerned about when you think about warfarin, right? You think about someone bleeding too much, right? Especially when you're doing some type of procedure, okay? Now, in terms of what they want to know, you're going to see things like anticoagulants, which we just talked about, warfarin, Coumadin, okay? And then you have the antiplatelets, okay? These are things like Plavix and things like that. So most times on the pharmacology section, they're going to give you the name and then Coumadin or something like that. So you'll be able to identify whether it's an anticoagulant or an antiplatelet, okay? Again, in the course, we go more over the different antiplatelets and anticoagulants and some of their significance. But for now, just remember warfarin, how it works, and its relationship to the coagulation cascade. Finally, this is super, super important. When they give you this patient box, they're probably going to ask you something or give you an INR, and they're going to tell you about some treatment that this patient needs, okay? This is what you want to remember. What you want to remember that in general, okay, in general, treatment, right? If someone is on an anticoagulant, especially the older anticoagulants like warfarin, then more than likely, these should not be altered before a dental procedure, okay? These should not be altered before the procedure. Now, even if someone has a pre-existing condition, some type of comorbid medical condition, your first option or on the exam, you should look for an answer that says consult with the patient's physician. So for the most part, that's what you need to know regarding the oral anticoagulants. Those are questions that have appeared 90% of the time on the exam, and you can't expect to see those again. Well, until next time.